This lecture is going to be on an introduction to calcium, phosphorus, and magnesium. In general, this is the list of things that can have an effect on calcium, phosphorus, and magnesium concentrations in blood. Young animals tend to have higher concentrations of calcium and phosphorus relative to adults. All of these minerals are acquired through the diet. Hypoalbuminemia can cause decreased concentrations of total calcium and total magnesium. Calcium and phosphorus can shift between the blood and the bone, and between the blood and the intracellular space. Excretion of these minerals are regulated by the kidneys and the mammary gland in lactating females. So, when you watch the lectures on causes of increases or decreases in these minerals, one or more of these factors may have an influence on the blood concentrations. Calcium, phosphorus, and magnesium are regulated by three hormones, and they are vitamin D, parathyroid hormone or PTH, and calcitonin. Vitamin D can be acquired through the diet or synthesized endogenously. Vitamin D causes an increased concentration of calcium, phosphorus, and magnesium in plasma. Low free calcium concentration results in increased release or synthesis of vitamin D, and high free calcium concentration inhibits the synthesis of vitamin D. Parathyroid hormone is released from the parathyroid gland chief cells. Increased levels of PTH causes an increase in the calcium and magnesium concentration, and it decreases the phosphorus concentration. PTH release is stimulated by low free calcium concentrations, and it is inhibited by high free calcium concentrations. Calcitonin is released from the thyroid C cells. It causes decreases in both calcium and phosphorus. A low free calcium concentration inhibits calcitonin release, and a high free calcium concentration stimulates calcitonin release. These hormones control blood concentrations of calcium, phosphorus, and magnesium by influencing their intestinal absorption, their deposition or resorption from bone, and their renal excretion or resorption. In non-horse species, most of the calcium that is ingested in the diet is not absorbed by the intestine. Instead, it passes through and ends up in the feces. A small amount is absorbed from the intestine, and this absorption can be enhanced by vitamin D. In horses, most of the calcium is absorbed from the diet, so it's readily absorbed, and a very small amount passes through into the feces. In all species, phosphorus is readily absorbed from the intestine, and a very small amount of phosphorus ends up in the feces. However, phosphorus absorption can be enhanced with vitamin D in non-horse species. So why do we even care about calcium and phosphorus? Well, in addition to helping with disease diagnosis, marked increases and decreases in calcium and phosphorus can cause pathology by themselves. Hypercalcemia and hyperphosphatemia can lead to systemic tissue mineralization, known as metastatic mineralization. Hypercalcemia can also cause nephrogenic diabetes insipidus, as well as neuromuscular signs such as seizures, tetanus, and paralysis. Neuromuscular signs can also be seen with low concentrations of calcium and phosphorus. And marked hypophosphatemia can cause intravascular hemolysis.